University of Miami, USA, in between us as our honorable speaker of the session. Namaskar, ma'am. Uh, we are also lucky to have our respected principal, sir, Dr. Pankaj Kumar Devnath, with us in spite of his busy time schedule. Thank you very much, sir. On behalf of the Geography Department of Cooch College, I took the honor to welcome you all in this beautiful academic evening. Now, I would like to request our Honorable Principal, sir, to deliver his welcome note for the inauguration of the program. Thank you. Sir, uh, Principal, sir, it is over to you now.
So very good evening to all of you present here. So first of all, I would like to convey our sincere thanks and gratitude to Professor Shouraseni Sen Roy, Department of Geography and Sustainable Development, University of Miami, USA, for accepting our request to deliver a special lecture today through this virtual meet. This is really a very rare opportunity to hear from you, staying in a long distance. The students and the researcher and the entire academic circle who will be participating here today from different parts of West Bengal and other states of India, and also from different countries. So it is really a wonderful experience for all of us. The students, especially the students and the young researchers, will be benefited from your valuable lecture, which will be delivered on a very, very special and very important topic regarding the impact of COVID on air pollution and human mobility. So this aspect of air pollution and human mobility due to this COVID, it's not limited to the students of geography, but it has a wider context. It is a very common thing that the academician from all the departments on all the areas of academic front are very conscious regarding that what will be the future impact of COVID on the existing air pollution and human mobility. I am very thankful to the HOD of the Department of Geography of Cooch Behar College, Professor Keshav Mandal sir, and all other faculty members of the Department of Geography, including UG and PG and Geoinformatics, for organizing such a very important international webinar. I would also like to welcome all the participants of today's webinar, especially who are joining from beyond our college, within the state or outside the state or outside India. I hope and I also trust that today's webinar will be a very successful one. I again, on behalf of all the stakeholders of Cooch Behar College, I again do convey our thankfulness to the renowned academician, Professor Shouraseni Sen Roy, for her consent to deliver a special lecture on this important topic. Thank you, Madam, again from our part, and thank you all of you present here. Over to Priksha.
Thank you, sir. Thank you for your valuable words. Now I would like to call Professor Keshav Mandal, sir, the HOD of UG Department of Geography, Cooch Behar College, and the convener of today's session, to say something in this platform. Thank you, sir. It is over to you. Professor Keshav Mandal, sir.
Thank you, Priksha ma'am. I want to again welcome to our resource persons, Professor Shouraseni ma'am, and all the participants also. So today I again thankful to our principal sir for creating these types of opportunity as these types of special lectures and webinars organized in each and every department as a context of NAC or our departmental developmental purpose. So it is great opportunity that Shouraseni ma'am has delivered a lecture for our department. Actually, in this situation, especially in the COVID situation, there are so many things are happen. Most probably, maximums are negative thing, but there are some few positive things are there. Just like if the normal situation that it is very difficult to organize these types of international webinar, so it is very difficult to organize because ma'am come from America to Cooch Behar, so it is just like impossible. But with the hand of this online platform, just like a very minimum cost, so we can arrange these types of webinar, and all the participants are also uh, can learn, can enjoy, and obviously can join these types of online platform classes. So I again thank to our Shouraseni ma'am. So in this present situation, actually so many things are just like in sense, maybe some positive, maybe some negative, but there are some positive things is happen in response to in respect to COVID, just like a air pollution. So so many negative things in relation to positive COVID, but at the same time so many positive, just like air pollution. So air pollution actually is a very bad thing, because in response to pollution, so many peoples are killed in every year in every part of a country. Actually we are ignoring, but we just know that there are so many people are died in a COVID. It is a very worldwide burning topic nowadays. But we don't know there are so many peoples are injured and died in case of air pollution. Actually, air pollution is a pollution. We are not avoiding these types of pollution. Actually, pollutions are so many types, just like sound pollution, solid waste pollution, soil pollution, so many types of pollution. But air pollution is like a pollution where we cannot ignore it, because the air actually in our lifestyle or in our life, we cannot live without inhaling a air, and we cannot restrict the air. So if the air is contaminated with the pollution, so that's why we easily inhale these types of air, and sometimes we face so many types of health issues and other problems. Not only air pollution not only affect the human, also there are so many another impacts, negative impacts are there, just like our wildlife, our flora, our fauna. Not only flora fauna, but also our some uh, some materials are also destroyed, or materials are also disturbed. So actually today our department organized one another already lecture, so already 2.5 hours already spent, and our participants are already spare 2.5 hours. So I am not continuing or not elaborating my lectures. So today is the day where our ma'am is presenting these types of very important and relevant lecture. So I stop my thinking. So today I again switch on to my mic to Pixa. Pixa, now start. Thanking all.
Thank you, sir. Thank you for your valuable words. Now, focusing on our principal sir and respected Keshav sir's words, today our respected speaker from faraway USA, ma'am, will deliver her lecture on impact of COVID on air pollution and human mobility. But before going to the main theme, I would like to say a few words that I'm very much glad and honored to introduce such an eminent personality, Dr. Shouraseni Sen Roy, ma'am, the professor of Department of Geography and Regional Studies, University of Miami, USA. She completed her graduation and master's degree under University of Delhi. She has done her MPhil from Delhi School of Economics in the year 2001, and after that she awarded for her PhD degree from Arizona State University in the year 2005, entitled as an analysis of the spatial temporal patterns of precipitation in India. Apart from this, she has also C++ and GIS certification from international institutions. She worked as research associate in the year 1999 with Sir R.B. Singh from Delhi University and Sir James Gardner from University of Manitoba in a CIDA SICI project on environmental impact assessment in mountain areas. She has been serving as teaching associates in several national and international institutions like University of Delhi, Arizona State University, Henan University of China since 2001, and finally served as professor in Department of Geography and Regional Studies in University of Miami from August 2005 to present. She attended numerous national and international seminars and conferences and workshops. She also published number of articles in reputed journals, written books. Professor Shenroy's interested areas are climate and environment. She was awarded by GIS Award, Provost Research Awards, and many more. Ma'am, um, thank you. Thank you very much for being with us. This is not all about you, we know that, but as the clock won't stop, so I'm handing over to you the entire session. Now, the session is yours. Welcome, ma'am, and thank you. The session is yours now.
Thank you very much, Priksha, for the very generous introduction. You made me sound really good, so thank you for that. Thank you to the organizers. I would extend a special thank you to Cooch Behar College, to Professors Keshav Mondal and Shomajit Ghosh for the constant communication, reaching out to me to organize this lecture. And of course, nothing would have been possible if the principal of the college, Professor Debnath, had not consented. I know how important your role is, Professor Debnath, in all of these organizations, in encouraging your faculty to do these kind of international webinars, events, and also exposing your students and faculty to different types of expertise. As you mentioned in your talk about how COVID has brought us a lot of misery. We all have been affected by COVID, more negative than positive, but we can also learn a few things from it. And one of the positive aspects of this is of COVID is the long distance these webinars. So I've been giving these talks long distance, and this would not have been possible maybe even last year or year before, because we never thought about doing these kind of online exchange. So yes, I'm very excited. I'm excited to share my research with you all about what I've been doing. Of course, when I saw the email was from Cooch Behar College, that's something. Cooch Behar is, of course, as a Bengali, everybody knows Cooch Behar. Who doesn't know as a Bengali? And I'm Bengali, of course. I was looking up Cooch Behar on the maps, and I saw that, of course, Cooch Behar is famous for the Rajbari, right, the royal palace. And I was
Yes,
very
ma'am.
close to visiting Cooch Behar Rajbari, actually, when I went to Bhutan, and we were in Alipurduar, and we had to catch a train back home, so we could not visit Cooch Behar Palace. So hopefully someday I will be able to visit your college and Cooch Behar itself. It's a famous place. So, all right. So that's about it. Thank you. So thank you all for organizing this, and I see a lot of attendees. So can I know a little bit about the I see some chats here where everybody is from. So I see University of Madras, Nanded. Is it all over from India or from are students from Cooch Behar College? What is the general demographics in or who are in attendance today? Keshav, you
Hello, ma'am. Yes. Actually, basically, maximum students are from Cooch Behar or West Bengal, but some of the students are from other states. But I can't find any student abroad, actually, out of India.
oh, all right. So
There are so many students are from other states also. Okay.
I will have to speak in Bengali. Okay, all right.
Okay. Actually, ma'am, I know you are very much fluent in Bengali and Hindi also. So you can use the mixed language, maybe English or maybe Bengali.
No, that's okay. So let me share my screen. So the sharing part is all, and again, I just want to ahead of time. I want to apologize um, if I just like everybody else, my internet can also become unstable. So sometimes I may just be kicked out or something. That has happened in the past. So just letting you know. So have patience with me on that, and we will get ready. So I think right now you all can see my screen. Let me know if you can see my screen now. Can everybody see my screen now?
Yes, your screen is visible now.
Okay, very good. Thank you. So as it was announced in the introductory, as Keshav Mundal mentioned about the topic of my lecture, and he also stressed on the importance of this topic. So today's lecture, some of you may have heard this in some of the other talks I've given, but this is based on 2 articles I published specifically on COVID. So I thought this would be a good platform to talk about those research and also get your opinion. I would be happy to share the papers that we published. So there's 2 studies we did. The two papers, I will introduce the 2 papers. They're both on COVID, the impact of COVID. One of them is on air pollution, and the other one is on human. So the first paper, which is on air pollution, which I will present second, basically going as a geographer, going from global to local. Pollution will be on Delhi's air pollution. So that's why you see India Gate. So as I mentioned, I got my most of my degrees, my undergraduate, master's, and MPhil and BEd from University of Delhi. So I grew up in Delhi, but I have connections in Kolkata, obviously, in West Bengal. More specifically, my grandparents' places are in Bolpur, Shantiniketan, and Krishnanagar, Nadia district. And so I'll be talking about the air pollution in Delhi, which some of you may know already that Delhi is one of the most polluted cities in the world. It ranks among the top most polluted cities. So it was obvious to look at the impact of COVID on air pollution. But when we started doing this paper, then the next idea came to me is that if Delhi's air pollution changed so much, as some of you have read already in different news media articles about how air pollution decreased so much in Delhi, I don't think Cooch Behar has as much problems as Delhi has because of its topography. Um, but then in Delhi, people started talking about seeing the blue sky, which was a very rare event for many. We don't see as much of the blue sky. So that made us think about how, if Delhi is affected by this, then how is the rest of the world, you know, responding to this COVID-related restrictions on lockdowns and human mobility. So let's get started. So as we all have been experiencing for the last 1.5 years, at least in the US, we have been experiencing for the last 1.5 years this this phenomena called the COVID-19. And it has affected us, all of us. So the total number of infectious disease outbreaks and diversity of pathogens has increased over the past few decades. So one of the things that COVID-19 brought out was that this is not something that is unique. This has been going on for several decades, just that COVID-19 really brought the world to a standstill. And as the world struggles to contain this rapidly spreading pandemic, hundreds of thousands of people are fighting for their lives. Each and every one of us have a family member or friend who has been affected by COVID. Each and every one of us have been affected personally by COVID, be it losing somebody or going through it ourselves. In addition, there has been a lot of talk about the global economy is in danger of lurching to a halt. So all different countries are talking about the effects of COVID, how unemployment increased, how students were not able to go to school, what is going to happen to this 1 year lost in the academic process. And as professors here, I would like to give a shout out to all my fellow academic professors who have been put into the front lines in some ways, I feel, as to how we can continue with the semester, continue with education and not stop it, so that students don't lose their valuable time in their lives. And in the process, at least I can say that I have learned a lot more about technology, like Google Meet, Zoom meetings, doing a lot more with online, doing a lot more with technology. It has also put billions of livelihoods in danger. Personally, here around my own neighborhood, I can see so many restaurants have closed down, so many businesses have filed for bankruptcy, big companies have filed for bankruptcy. Same is the case in India. But the total number of infectious disease outbreaks and the diversity of pathogens have increased, as I mentioned, over the past few decades. As you can see, here are some examples of the different types of pathogens or diseases that have occurred over the years. So there has been, of course, we can talk about chikungunya, which is big in India. Also, dengue has become quite big. Dengue was always big in India, but dengue has also started spreading in North America, especially in Miami. We talk a lot about dengue. Zika virus, which started in Brazil, was also found in Florida. We had quite a few cases of Zika virus. And just a few days back, I heard that India has reported a few cases of Zika virus. So it's also spreading. These are the different vectors that are spreading, which we are not talking about as much. There's been other ones like SARS, Hainai, MERS, which started in Middle East, to Ebola virus, which started in Africa. So we are seeing there have been the spread of different types of viruses. It's not something that COVID-19 is not something unique. But what is more important is that these viruses have been spreading more. The spread of the virus has been more widespread in cities, and there have been several causes for that. Urbanization has been increasing, so cities are only increasing in size and in density. So more than half of the world's population now lives in cities. These are also hubs for transnational business and movement. and therefore they have the potential to amplify the pandemic risk. Cities also have high concentrations of urban poor and deep inequalities, which makes them more vulnerable than those that are better resourced or less crowded and more equal. So cities are also which are crowded. There's a lot of people who do not have adequate infrastructure to, live in houses or proper housing or proper sanitation, which also amplifies the spread of these diseases. So here is the percentage urban and urban agglomerations by size. So as you can see, of course, Asia is starting to dominate, but Africa is a continent which will be soon be taking over in terms of population. This is a continent which we need to focus on more if we want to not make the same mistakes we have made in Europe and Asia. And so here's a increase of urban agglomerations from 1970 to 1990, so to 2018. So as you can see, the big cities are all showing up in mainly in India and China. Those are the big two countries which are starting to dominate in terms of the big cities, the urban agglomerations. India itself has several of the big cities, starting with Kolkata, Delhi, Mumbai, Chennai, the four big cities, but then there are several other major cities that have cropped up over the years. So why cities? Cities are dual-edged. Infectious disease outbreaks, they intensify the spread and transmission of infectious disease through increased human contact. And as I mentioned, that 4 billion people live in cities, more than half of the world's population, which is showing no sign of declining. It is just only growing. 600 cities generate 2/3 of the global GDP, and these are also hubs for transnational commerce and mobility. Densely populated, voluntary and forced migrants, hyper-connected cities, therefore can amplify the pandemic risk. Cities also are more vulnerable to pandemic spread, mainly because of the presence of large international airports, seaports, where we have a lot of movement of people. So as we saw in the case of the United States, the COVID virus came through the big airports. It mainly first started spreading in Seattle, where we have a lot of inbound flights directly from China, and then Los Angeles, those California and Washington. So Los Angeles, San Francisco, Seattle, those were the first cities to start reporting COVID-19. But it spread very fast. And Florida, it reached Florida quite late, but Florida, because of its weather, Florida actually had a massive outbreak of COVID-19. And at one point, the number of COVID cases in my particular district or county was bigger than the entire country of Canada. So dense populations in cities can provide conditions that promote disease emergence and transmission, diseases with respiratory, oral, fecal transmission pathways. So here are some major ones before COVID-19, 2003, the SARS virus, 2009, Hainan, 2014, 2015. These are the different major virus outbreaks that has happened. Bird flu, all of you might remember. So it's not something that we are not aware about. And even though we all have been caught very unprepared. So urban health sits squarely at the forefront of global health. And so notable examples, as I showed you before, 2003 SARS, 2009 Hainan influenza, which started in Mexico City and was found in New York City, but was contained. 2014 to 16 was West Africa, the Ebola spread to international cities. And then 2015 was Zika, which was Rio de Janeiro, Sao Paulo in Brazil, 2 other cities in Americas, including Miami. And now it has been, reports have come out from India that Zika virus is spreading there. And so it is important to study these outbreaks, not only from the medical point of view, which is the most important, how many people we have lost, how many lives have been affected, but they also have significant economic impact. And here are just some examples of economic implications, which includes SARS outbreak cost the global economy 30 to 50 billion US dollars. The 2014 Ebola outbreak cost over 50 billion US dollars. And COVID-19 is still ongoing, to be seen what happens. So here is another one. So going back to the urban agglomerations and cities. So as you can see, just growth rates of urban agglomerations by size. Again, Asia stands out, but Africa is soon catching up. But as you can see, the number of big cities that have shown up here in India and China, and just the amount of land and the concentration of these cities within a very small area. So that brings me to my first paper that I'm going to discuss is the role of human mobility and policies in COVID-19 cases and interactive spatial web application. So let me briefly mention about my co-author, Chris Chapin, who is unfortunately not here. He has to go to work. But I really want to highlight my co-author here because he was an undergraduate student. So I know there are a lot of students in the audience today. And a shout out to all the students there. This is something that you all can do. So Chris Chapin was an undergraduate student in the School of Business. But he took a few geography classes, and then he went on to do an independent study. He did his master's. He started as an undergraduate in geography and business, and then he went on to do his master's in data. And he wanted to do a independent study, a research project with me, and I wanted to know what is the impact of these different government policies like lockdown or just staying at home. We all started staying at home, not going out. What is the impact on COVID-19 cases? So we started by creating what is called web application. And so some of the arguments or some of the motivating factors that led us to do this was that COVID-19 pandemic has hindered normal activities across the world, including mobility. So we all switched to online delivery, started going out less. So we all saw that there was COVID-19 had reduced mobility. So public transportation in Tennessee dropped as much as 66% from 2019. Mobility and government policies reduced COVID-19, like travel restrictions in the UK, helped decrease the number of COVID-19 related deaths. And of course, you all know about the nationwide COVID-19 lockdown in India back in April 2020, which was severely criticized. And I'll talk about that in my second study. But first, we wanted to understand the relationship between human mobility, government policies, and COVID-19 through the creation of an interactive web application. So what we did was we collected the confirmed cases of COVID-19, aggregated daily and cumulatively since January 22nd, 2020, so about a year long now. This data was first released. There was a dashboard that was released by Johns Hopkins University. So you can all access this link. I'll share the link with you. Let's see if I can. No, I'll share the link with you guys after the lecture. But you all must have seen this Johns Hopkins dashboard that was first brought out, and it shows the county level, country level number of COVID cases around the world. And then we came up with this. We came across this data. Actually, my husband came across this data and told me about this data, which is Apple Mobility Trends Reports. So Apple Maps. So what Apple has released their data on the number of requests made on an iPhone or on an iPad or on any Apple device to get from one place to the other. Using either driving or walking or using public transit like metro rail, subway. And this data, they were available at the country level, at the state level, and at the county, or what in India we call the district level. So we got that data, Now, of course, one of the criticisms that I get about this data is that not everybody owns an Apple device, especially outside the U.S. More people, more of the population owns Android phones, so more requests are made through Android phones than iPhones, and I agree with that. But as you will see the app, you will see that this was just the first way, and we are never. The purpose of this app was to generate discussions, and it's very interesting to look at, even just looking at Apple mobility trends, how the mobility changed with lockdown, with policies. You can definitely see the impact. And then University of Oxford, you can all look at this data. University of Oxford created this database, which is the Government Response Tracker. So they started looking at COVID-19 related policies put in place for a government on a given day, reported since January 1, 2020. And so this included containment and closure policies, health system policies, school closures, lockdown policy in India, all of that. Oxford University was tracking those. So we took those three together and we created this app. And I'm going to share, let me see if I can share this app link so you all can take a look at it. So you can look at this app, and as the app loads, so what we have is you will see on the left side, if you all can access it, on the left side is the map. And the maps are created, the association is created between country level, at the county, state level, and county level. So we did not have data at the state level. So in case of India, for instance, we did not have the data at the state level. We did not have the data at the district level for India. But in the case of US, the data were available at the state level and the county level. So was the data for Apple Mobility also. So therefore, what we did was we looked at the association between, so my internet is slow. So the association between, so what you can do is you can go here and you can click on this button here and you can choose whatever country you want. So you can just backspace it and say, let's say India. And India shows an interesting pattern, if any of you already looked at it. So what we found was that in case of India, when mobility was going up, COVID-19 was going down. And we actually talked to one of the Times of India reporters about our app, and she asked us, why is it so? And the question is, we don't have answers to everything, but one of the reasons why in India it was a negative correlation between mobility and COVID cases is the rate at which it is reported. So how much time it takes for them to report. So here, as you can see, this is on the top. It went back to US. So let's look at the US first. So in the US, as you can see, the bold red is the COVID cases. And then the purple ones, you can see purple is walking, blue is transit, and the green is driving. So at the beginning, around March or April, as you can see, human mobility completely fell when COVID-19 started surging in March and April. And you can see that COVID cases also dropped. And it kept low, and then it started increasing here. And you will see there's a lag as COVID cases rise. So at the moment mobility rises, COVID cases take a few weeks to rise. So there's like a lag relationship. Of course, you go out, you start transmitting. It takes about 3 to 4 days to start the symptoms to come, and then also start testing and finding out that you've got COVID. So anyway, so you can just go here and you can select here state level or the county level. So this is the state level. Here is Florida, just to show you what Florida looks like. So Florida, as you can see, we had a major outbreak of COVID cases last year, and then again this year also. It's quite high. It went down, but it's again starting to rise because not a lot of people have taken the vaccine. But it was last year, like this year in the January, February, and last year in July and August, we had major peaks in COVID cases. And in case of Florida, so this is where government policy plays a role. In case of Florida, we didn't have very strict regulations in place. We did not have strict lockdown measures. We didn't our governor was very lax, as a result of which human mobility never dropped. Human mobility kept high only. And so you can see that by the public transit, it dropped a lot. And you can go on about it. So let's look at India for that matter. And I've shared the link with everybody, so you hopefully you all will use it and give us feedback what you think, what you don't think. Everybody, there are different types of viewpoints people come up with. So you can see here, this is a very encouraging graph. I like to see this graph all the time on India because you all remember that huge peak we had back in May. Everybody was affected by this peak and how human mobility completely dropped during that period of the month of May. And then again, human mobility has been going up, and the policies have dropped. There's not much lockdown measures, no measures right now in place, and COVID-19 cases have been dropping. So that's encouraging to see. How, and so some have asked, like, why is there a negative that human mobility drops and COVID-19 peaks? And my argument is that first you have to go out, you have to mix, the transmission occurs, and then after a week or two, the COVID-19 starts speaking. So so going back to my presentation, so you can and we have been updating this data almost every day, not every day, every week. We try to update the app so you all can use it. I encourage you to use it. Give us feedback. The information is already there about the email, and you all have my email information. So feel free to use it. So what did we learn from that paper? So this is what. So once we did that, created that web app, we decided, it's something that has been done, but this should be promoted more widely. So we wrote up a paper. So again, back to the students. So students, don't feel shy. Your professors know a lot. Work with them on research projects. It's really fun to have a paper published there. So takeaways: pandemic and subsequent government reaction caused a rather sudden decrease in mobility, and evidence of a link between changes in confirmed cases of COVID-19 and changes in mobility offset by a lag in time. So there was, and this lag in time between COVID cases and human mobility changed from location to location, from state to state, from city to city, from country to country. So there was no clear same level of lag or same kind of correlation between the two. Higher degree of spatial autocorrelation of mobility and COVID-19 case patterns. And the broader significance is that useful for tool for other researchers to explore areas of interest for policymakers, and also serve as an example of interactive data visualization. So we want you to use it. We want you to use it. We want you to give us your feedback, what you think of it, explore it, and develop more. The students, again, I'm going back to the students, I'm shouting out to the students, explore more using similar kind of data. So given that we now do see there is an impact on, how am I doing on time for that matter? Am I good, Keshav? Let me see.
Yes, please go on.
Am I good on time, or am I out
Yes.
of time?
No,
Yes,
it's okay. It's okay.
Okay, all right. Thank you. Just stop me when, because I'm not able to see the Google Meet screen. So let me know. Just speak up if I'm running out of time, or if you have any questions. But we'll
please
take the
go on,
question.
ma'am. There is no need to stop you. It's very much interesting. Please go on. Thank you.
So all right. So then the next one we did was actually, this paper was before the last paper. So this paper we did last year actually. So when the lockdown happened, if you remember, Prime Minister Modi, instituted a major nationwide lockdown, and we went from the whole country went from like no trains, no transportation, nothing, and there was this whole mass migration of people all over the country because they didn't have jobs, they didn't have food to eat, and it was really chaotic. But what came out of it was some of the big metropolitan cities saw a major drop in air pollution. So there have been studies done on Chennai, there have been studies done on Kolkata, studies done on Delhi, in addition to my study, looking at the impact of COVID-19 lockdown on air quality in Delhi metropolitan region. So just like I talked about my previous co-author, I would like to introduce my co-author for this paper, Professor Robert C. Bolling Jr. And this one is to all senior academics in the discipline. I see a lot of young faculty there, but to all of you young faculty, you all have an advisor who brought you here, who got you to made you do the research, trained you, who helped you to come this far. Same as for me in my case, was I've had the good fortune of having good mentors, and I would like to take this opportunity to give a shout out to Professor R.B. Singh. He was my first mentor who got me interested in research. He got me interested in academics. He got me interested in MPhil. He's the one who taught me how to do research, get me interested in research, get me into higher academics. I was not the best student ever, but Professor R.B. Singh was the one who really got me into it. And without his encouragement, I would never have gone for my PhD. And then in my PhD, I had the good fortune of working with Professor Robert C. Bolling Jr. And he's the one who got me excited about publishing papers, getting your research to the next level. And also, he's the one who instilled that pride in working with students. So I have, if Priksha looked at my CV, obviously, so you may have seen I have multiple papers with Professor Bolling. He still remains my mentor, and we collaborate still now. So again, to the young academics, young faculty, I see a lot of them here. Keep working with your collaborators, with your with fellow academicians, and just working with the students. There are so many different ways to collaborate. So, so this is the paper we did about is the impact of COVID-19 on air quality. So let's look at what happened in cities. As I started my talk about cities, transmission in cities. So risk is not only limited to global cities, but also secondary cities and urban hubs. So this COVID-19 has been reported. It has been seen that it transmits faster in densely populated, congested cities where people live together. So like New York City, everybody almost left New York City because everybody lives in apartments. And in the US especially, a lot of people moved to these suburbs, to the rural areas, because they wanted to be away from people, away from the transmission. So cities, research indicates pandemics often emerge from the edge of the cities and then have major outbreaks within the city because there are a lot more people. So viral outbreaks are frequently incubated and transmitted via peri-urban communities, transportation corridors at the outskirts of cities before they spread into the downtown core. And local and global supply chains, travel networks, airports, specific neighborhoods that are sources of contagion. And we can talk about that in terms of our Indian cities. So as a result, cities must be proactive in ensuring population needs are met, since healthy and resilient populations are key to a thriving city. And we have definitely, hopefully have learned from this. Governments could benefit from Pandemic Preparedness Index, a better plan for and respond to epidemic outbreaks. But there's currently no such map of city preparedness around the world. Hopefully this COVID-19 pandemic gives us an opportunity to better prepare in the future for any such major outbreaks. Now, talking about cities and air pollution, as I mentioned, that Delhi has consistently ranked. It has taken over from Beijing as the most polluted city in the world. It has very high rates of air pollution, especially particulate matter, PM10 and PM2.5. This is one of the graphs I found, and there are many such graphs. And you can the city order can change, but Delhi always remains on the top in terms of air pollution. So therefore, it made only sense that why not study Delhi's air pollution and the lockdown measure impacts. So Delhi's toxic haze is a deadly health risk to its residents, particularly children, the elderly, and the ill. I myself, personally remember when I was a kid, a little kid, many years back in my school in Delhi. There was only one student in my entire class who had asthma, And she was treated as special because she was the only student who had some respiratory issues. But now when I talk to my friends who have children, um, and other others who have even younger children, they talk about it's a common issue in Delhi to have respiratory asthma or respiratory related issues. It's almost every child has it. So particulate matter, which is PM 2.5 and 10, far exceeds national and World Health Organization limits and is a main culprit for Delhi's high incidence of cardiovascular damage. So the city's toxic air, it has such high levels of sulfur dioxide, nitrogen oxide, carbon monoxide, that it puts people at higher risk of strokes, heart attacks, high blood pressure, and the worsening respiratory complications from COVID-19. So as you saw that even this last outbreak in May, um, Delhi was always in the forefront in terms of the number of COVID-19 cases. And the main sources of Delhi's particulate emissions are in equal measure particles from large power plants, refineries, vehicles, stubble burning. Especially, it has become a major issue in Delhi for all the agricultural farm. The stubble after the harvesting, they burn the crops that is left in the field, and that causes major air pollution in Delhi. That has been a major issue in Delhi for some years. And so this is what it looks like. This used to be a few days when I was growing up in Delhi. We used to call this like the fog, the big fog in Delhi. But now this has become a daily phenomena when you can barely see the Rashtrapati Bhavan or the India Gate, and the lights are always on because it's so dark. It's hardly able to see. There are major traffic accidents, pileups, that are caused by this kind of fog or smog we can talk about. But and there have been a lot of studies. I also have published paper on Delhi's air pollution levels. So it's very well researched. But the lockdown gave us an opportunity to look at what happened. Of course, and these are the images that came out in the international media about the big migration that took place of people moving from one area of the country to the other, walking so many kilometers just by foot because there was no forms of public transportation. And some of the big, so those images started coming out, and then it was considered India unlocked a world's biggest lockdown or workers' long march. These are the different, headlines that were coming out in the international media. So sitting from here, I was monitoring, and I just thought this would be a good opportunity to study what was going on. And then NASA came out, the National Aeronautical Space Agency. They came out with the satellite images showing that just a change in air pollution as a result of the lockdown. So you can all see it for yourselves. This is the top left image is 2016, then 2017 each year, and then in 2019 the anomaly. So 2020. So you see the last image on the bottom right is the anomaly from the previous year. But you can just see for yourself that how much, especially the Gangetic plains, the northern Gangetic plain, that's the area which is the most polluted part of the world, and that how much the pollution came down. Pollution here comes from coal and coal-fired plants, from all the mining activities that takes place here, all the agricultural crop burning. So all of that went down. Even look at Kolkata. So the entire country, there was like almost like a cleansing of the air as a result of the lockdown. So, and then as a result of which, there were these other headlines that started coming out that Delhi breathes easy as COVID-19 lockdown lowers pollution levels again. Air pollution falls by unprecedented levels in major global cities during COVID lockdown. There were these big highways in Delhi which showed which were completely empty, which are usually, even I have seen, they are like back-to-back, bumper-to-bumper traffic. They were empty. And these were some of the landmarks in Delhi, which on the left is a regular day, and it's back to that now. And then as a result of the lockdown, we could see clear blue skies. My family in Delhi, they were complimenting how beautiful the sky looks. They could hear the birds, the trees were green, everything looked so pretty. And here's that iconic image of India Gate. during regular days, and then we could again see India Gate in its pink sandstone against the blue sky. Looked beautiful. So that brought me to do this paper to look at the air pollution. What happened? How much did actually air pollution drop, and what did the air pollution really drop that much? Is it, can we quantify? We are seeing all these images, all of these headlines, but really did air pollution drop that much? So to quantify that, we collected the station level hourly data for PM10 and 2.5 from the Central Pollution Control Board. This is collected as part of the air quality monitoring program in India. And again, to all the students, I'm going to give a shout out. You can collect the data yourself. This is nothing, none of this is proprietary. I'm sitting here, I downloaded the data. India has become, the Indian government has become a lot more better with data sharing. Even 7 or 8 years back, when I did my first air pollution paper in Delhi, it was very hard to get the data. I had to, for one whole year, I had to go and visit the offices every summer and ask them for the data. And finally, I got some data. But now all of these data are freely available online. So I'll be happy to share my paper with you all so that you all can look at it and think about other things that you can do. You can do this for Cooch, Behar. You can do it from Kolkata. These are just some ideas. So what we did was we looked at April 2019 and 2020 to assess the change in pollution levels to the lockdown. And we were very happy to see that there were like 34 stations for PM10 and 31 stations for PM2.5 across the Delhi metropolitan region. So of course, all of you know where Delhi is located, but here are the distribution of the different stations across the city. So they're quite well spread out. All parts of the city are quite well represented. Of course, there are a clustering of stations within the central part of the city and less to the outskirts, but still it's quite well representative of the general layout of the city. I also wanted to look at, because there was so much talks about, how the greenness changed, plants were doing better. So I also wanted to look at the normalized difference vegetation index, which is basically a level of greenness across the landscape. So I downloaded images, Landsat imagery for 2 cloud-free days, April 28, 2019 and March 29, 2020. And they are around the same time. It's just because, Delhi, it can be cloudy, it can be hazy, whatever. So I tried to get satellite images which were the clearest, but also around the same time, not too different. So within a 1 month period of time. I calculated the NTVI. And then the results of my, I also calculated the diurnal. So once I got the hourly air pollution data, which for those 34 stations, I did 2 parts. One was to calculate the diurnal, the daily time of maximum for these different air pollution variables. And second was to calculate the difference, the absolute difference between the 2 years. So to do that, the spatial interpolation, which you will see to create continuous surfaces using geospatial technology, GIS, to map continuous surfaces of, time of maximum or minimum and all of that. And then I used harmonic analysis to calculate the time of maximum for the peak time of air pollution for PM10 and PM2.5. So here are some of the results of it. So changes in levels between April 2019 and 2020. So PM10 and PM2.5. Just to orient you, the red bars are 2019, the black bars are 2020. And as you can see, uniformly everywhere, air pollution went down in 2020. The levels of air pollution went down more within the core of the city and in eastern Delhi. And I'll tell you why. The core of the city is, of course, those of you who've been to Delhi or know about any city, the core of the city is the downtown of the city. That's where most of the activities, the offices, the commercial business, everything is locked. It makes sense that air pollution will go down the most because of lockdown. But it was also eastern part of Delhi. That's where we have all the coal-fired plants, the gas plant, lots of brick kilns. That's where eastern Delhi also experienced a lot of industrial activity. Eastern Delhi also experienced a massive decrease in air pollution. So that part was substantiated, and as you can see in the background is the spatial interpolation. So you can see from it went PM 2.5 went down as much as 90%, whereas in case of PM 10 it went down up to about 70%. But it was the central and eastern part that's where the maximum drop in terms of percentage of air pollution levels. I mentioned that the other part we did was to also look at the change in peak time of these air pollution, PM10 and PM2.5. This is the average. This is for average levels of PM10 and PM2.5. And, so just to orient you how this works, the reds are 2019, black is 2020. And then the direction to which the line is pointing. So the line is pointing directly to the north, that is midnight. If the line is pointing east, that is about let's see, 6 a.m. If the line is pointing down south, it is 12 p.m. And if the line is pointing west, it is 6 p.m. So it's like the time of the clock. And so whichever direction the line is pointing shows what time the air pollution peaked. So just to show you in northern Delhi, the time of peak for air pollution was mostly early morning hours. That's when it's coolest, the air settles down. And so what we saw was that there was a difference, and that difference changed from station to station, location to location, but there was a difference. Either the time of maximum for PM 2.5 mostly peaked earlier than later, which can be again related to human activities. The change was much more significant or much different. Stark contrast was more in the case of the minimum levels of PM10. So when did the levels of PM10 and 2.5 was minimum? And then is the maximum, which also showed quite a bit of difference in terms of the peak time of maximum. The next I did was to look at the spatial patterns of NDVI, the vegetation. So I calculated the vegetation NDVI for 2019, and I calculated for 2020. So you can see, just looking at these two images, I don't have to tell you, what happened. So just a few things to remember: the darker the green, higher the greenness, higher the vegetation level of vegetation, the health of the trees was better. And that red line you're seeing in the 2020 image is the river Yamuna, or Jamuna as you call it in Bengali. So you can see the differences in the spatial patterns, the downtown, and you can just go on about it. I did a subtraction. I did just difference between the 2 years, where the vegetation went up, where the vegetation index went down. So there are two colors in the bottom. So the dark color shows that 2020 was greater than 2019. And the light color shows that 2019 was greater than 2020. So it's not that everywhere vegetation went up, that this is also important to note, but we can see that more area had increase in greenness versus others. So finally, the results and discussions: a substantial decline in the levels of PM10, 20 to 70% versus PM 2.5, which went up to 90% in air quality across the Delhi metropolitan region. And the highest decline for particulate matter was observed over the downtown core area and the adjacent industrial areas in the east and west. And overall decline in PM10 was more widespread than 2.5. And the time of maximum values did not change significantly between 2019 and 2020 for the average values, but there was a significant difference for the minimum levels and the maximum levels. So average did not change that much. So what did we learn from this? There is a lot of criticism about the lockdown, and I'm not saying that lockdown was the right measure or not. I am not giving an opinion on that. But what we can learn from this, that some of the pollution control measures that can be put in place, like coal-fired plants. So Delhi's environment minister had called for the closure of 11 coal-fired plants operating within 300 kilometers of Delhi. But only about in 2019, 10 coal-fired power plants missed a December deadline to install pollution control devices. So we need to have better policy implementation. We can learn from this, and we can have better policy implementation to make our air cleaner. As Professor Mondol mentioned about that, we need to breathe, and so we need to take these measures. We should learn from these initiatives. Cleaner transport. Delhi has tried to promote tracking of vehicles by mobile enforcement teams, public awareness campaigns, investment in mass transit systems, phasing out old commercial vehicles. But I still, when I go to Delhi, I see old cars that are not supposed to be on the road are still there. The recent push for electric vehicles shows promise, but it needs to be implemented better. So what we are seeing in case of Delhi and in other parts of the country is that there have been the results on cutting pollution have been weak because of poor governance and cooperation at every level. Better farming practices. This has been a major complaint. The Supreme Court has ordered a complete halt to the practice of stubble burning and remanded authorities in 2 of these states, Punjab and Haryana, for allowing this illegal practice to continue. The IARI has proposed a low-cost way to deal with the problem of stubble burning by spraying a chemical solution to decompose the crop residue and turn it into manure. But this remains a problem in terms of the crop burning. And final thoughts, Delhi, projected to be the world's most populous city by 2030, is motivated by sense of urgency. What we do in Delhi today, other cities can learn from them. So let's be an example. Let's be a leader in bringing down air pollution levels. But to succeed, the different levels of government must harness the political will to invest more, coordinate across boundaries, and motivate businesses and residents to do their bit. So as residents, as citizens of the country, we can do better. We should try to take measures to make it better. We are all in this together. So that's it for today, the current situation. And I'm going to end my talk and open the forum for discussion. Let me see if I can find my Google Meet. And I'm going to stop presenting. And any questions, comments, suggestions, all are welcome. I know that you had some other talks today, so you all must be tired by now. So to you.
Thank you, ma'am. It was a very clear, informative, and easy to understand session. Whatever we have just faced and still facing in this purpose of mobility and effects on environment during this COVID-19 situation, by being stuck in home, you just make us visualize those things by the presentation. It was very, very, very much informative. And I can't see any questions in the chat box right now, but there are so much appreciation for you. So many appreciations. All are saying that it was a very much understandable presentation, very good presentation. And all the participants who have mentioned you here, just thanking you, ma'am.
Ma'am, I just have some questions.
Okay, sir. So
Okay.
you can ask.
Yes, ma'am. Actually, ma'am, I also have a research on air pollutions. Actually, spatio-temporal air pollutions in Durgapur. Durgapur is the Eastern Eastern industrial city. Hello, ma'am. Are you listening?
Yes.
Yes, actually, I'm working on a pollution, spatio-temporal variation of air pollution in Durgapur. Durgapur is a city in Eastern India, especially industrial city. So in Durgapur, there are main source of pollution is industrial, sponge iron, and some alloy steel, and there is some another industry. So and obviously transport is another source. So how we control or how we minimize the pollution? Actually, if government how can we what are the steps can do we and government also? Actually, in the general people, Actually, most of the things maybe we can put a mask and we maybe shift our home to from industrial source to another source. And what are the other things can do for general people and for government also, ma'am?
Okay. So good question. So a few things, just as I mentioned at the end, that there has to be awareness. That's why I want to, promote this app also, so we can all talk about it. There has to be awareness, and there has to be. Not everything can be done by the government. What can we do on our part to reduce the levels of air pollution? So can we, instead of in Delhi, I see everybody has 2 or 3 cars. There's just a lot more money. Growing up, I remember we used to have only 1 car in the family. Now there can be 2 or 3 cars per family. Some of the measures that have been taken by other countries, I can give you examples. So I was in Colombia recently for a Fulbright specialist assignment, and there I went there 10 years back, and even then 10 years back, Colombia had this policy that not everybody can drive their cars every day, and so they made this policy that on certain days of the week, so I think 2 days a week they will allow only odd numbered cars license plates to drive, and 2 days a week they will allow even numbered license plates to drive. So that was trying to bring down the number of traffic in the on the street, so that not every day all the cars are on the street. So that was one way. When I went to Colombia this May, just this past May, I was told that if not everybody can get into the malls, so they can't go into malls and they can't go into theaters or be outside, because to enter the mall you have to show your driver's license, and if your driver's license ends with an odd number or an even number, so there are certain days only odd numbers can enter and certain days even numbers can enter. So these are just some basic policies that have been put in place. What are the other ways? So Delhi has instituted the policy that they are going to convert to CNG. That was back in the early 2000s. And then, investment into more into public transportation, biking to school, biking to the university, staying closer to your work. Also just trying to, just trying to minimize our carbon footprint. So not everybody is fortunate to live close to the campus, close to work. Sometimes it's expensive, but if we can just bike to a public transportation, or take measures, just take simple, like plant a tree. If you have a garden, plant a tree, or even just to talk to others about taking conscious measures to reduce levels of air pollution. So even 5 years back, my students, I will go to teach in a class, and the students will all walk in with these those Bisleri bottles. In India, Bisleri is very popular, so here they would walk in with the Sani bottles, plastic bottles, bottled water, and they will just go to the vending machine, buy a bottled water. And in the last 1 or 2 years, and I've complimented my students on that, is that they all walk in with their own bottles. They go and fill up their bottles from the taps. So what happened? The tap water was made more clean. They installed filters in the taps, and then students now go around with their very stylish, expensive Coach and Gucci bottles, but they fill up their bottles with the tap water, and they're proud to show their bottles. So they're just simple measures that we can take. Just try to reuse, recycle, and reduce our carbon footprint.
Actually, ma'am, I know, but actually, Durgapur is not so in case of Delhi, not so polluted in case of Delhi. That's why uh, not only general people but also educated people cannot accepting and cannot realize that this problem has happened from air pollution. So that's why they are not accepting these types of measures. So if government should doing these types of measures, then general people can obey these rules. So that's why actually Durgapur is the city PM10 level is more in winter season, and sometime SO2 and NO2 are also very dangerous situation. So that's why in a near future it may be very high in future. So that's why the awareness can be made from We know, but general people are not accepting these types of awareness. So government should take some actions.
Ma'am, in
So,
continuation of the talking of the Keshav, I, Dr. Tapan Kumar Das, the Assistant Professor of Geography, just want to take one another instance in our college. I have seen that yeah, we practice some good practice, that is on the first day of every month. We do not use any vehicle, but most of the students are coming in by their vehicle and keep their vehicle outside of the college. As the as the on that day the gate is closed for the vehicle. So actually the problem is the lack of awareness in India. And as you are Indian by birth, what's your suggestion to actually increase this awareness?
Yes, ma'am. Yes, ma'am. How to increase the awareness or how to realize the general people.
Actually, no law can actually lead the people. There is a tendency to breaking the laws.
Yes, ma'am. Yes.
well, as a Bengali myself, if you ask my husband, he will say I am also a rebel. I also break laws, so I can't talk to that. But I can tell this much, that as academics, as yes, so you have a lot to play. You can you yourselves can also, like for instance, I have tried to have more discussion in my class to create awareness, because as students, the students who are in college now, they are the future leaders, they are the future decision makers, and it's in their hands how they make their lives. So if we can start having this conversation, at the early level, so just like you mentioned at your college, no vehicles, but as universities, as professors, if you can yourselves take the time and start practicing, or keep talking about it. And I have seen it in my students also. It slowly comes up, if you start talking about these, show them videos, show them the effect of their own actions. Like Durgapur is a great example. I know Durgapur also has a steel plant, if I'm not wrong. Is it steel plant, or I think steel plant? But anyway, so what you can do is you can do different activities with your students, or you can, as I was mentioning to the students, that the air pollution data are freely available. If Keshav, you're working on Durgapur
Yes, ma'am. Yes, ma'am.
you can show the results of your own research. You can I often do that. Like I teach a class on crime mapping, and so I give them crime data for Miami, and that's what is the best way to do it. Give them data where they are living, so that way they can learn more about it. All the data are freely available. Believe it or not, air pollution data, the India has become a lot better. I was amazed how easily the data are accessible for air pollution in India, and same with other types of data sets. Just look around, and you'll find it all. So I see
Okay.
Mihir.
Okay, ma'am.
Thank you very much. Thank you.
You're welcome. Mihir has raised.
Yes.
Yes, thank you, ma'am. It was a very informative and nice presentation. Ma'am, I had a query. As we know, several studies has revealed that the mortality rate of COVID increases with the if we are staying in a polluted city, the rate of mortality increases. COVID mortality. So Delhi is one of the most polluted city in this country. But why government is not taking strict restriction for air pollution to resist air pollution in this country and to reduce COVID death also?
Well, I will revert back to Dr. Dash. I think Dr. Dash made this comment about not allowing students to drive to their colleges. And so what they do, they park their cars outside the college. So let's not blame everything on the government. Of course, the government can do a lot, but why should we wait for the government to do something? It is our life, our future, our air. As Dr. Mondol mentioned at the beginning, it's the air we breathe. It's our air. Why not we take actions on our own? We can't change our lives completely, but we can take small measures to make it better, right? So if you have a small garden, plant a tree. If you are driving to school every day or biking to school every day, ask your friend and carpool with them. You'll be amazed how much. And there are a lot of online carbon footprint calculators that you can use to see how much you can bring down your carbon footprint. You'll be amazed. So let's not wait for the government to do something. And as a Bengali, as Dr. Dash mentioned, we are rebels. So yes, I'm a rebel, and I'm not going to wait for the government to make it better for me. I should take my own actions also. I think so.
And not only that, I want to share another thing. I usually come to my college with my bicycle, my cycle. Okay, but if I take the data in a week, at least 2 or 3 students will tell me, "Sir, why have not you got any car or any motorbike?" So what?
Yeah,
But
I also walk to school. I also walk to school, and I actually joke that I walk to school, and if I die one day, it will be by an angry student hitting me on the road because he or she did not get a good grade.
Ma'am, but being a Indian, I don't think awareness, spreading awareness among us is not that much easy. So
Why not?
government was avoiding about wear mask, don't go outside while in lockdown. So people still goes
That's
outside. They do not wear mask. But when the police started beating, they reduced going outside
right.
and started wearing mask. So I think
Yes.
strict regulations or initiatives needed, very much needed.
Yes, and strict regulations. So talking about COVID restrictions in France, for instance, they made it so strict that you had to have a printout, a small paper printout, to leave your house for 1 hour walk during the COVID peak. That's what France was doing. In China, there's face recognition software. So you walk into a mall, your face is captured, and then if somebody else walks into the mall with a COVID positive, then they will automatically inform you that you are under, COVID threat. You have to go into quarantine, and the cops would come and check on you. So yes, there are. Do we want to go into that kind of society where we are under surveillance all the time? There is a lot of drawbacks to it, or do we want to just take measures ourselves? Like Dr. Dash was saying, he bikes to school. So let's try local. Let's try at our personal level. What can we give up? Let's make a pledge today. What can we give up today to make our lives better? And there are small things that we can do which can make it easier for us. It's not everything has to be walking 5 kilometers to school, but it can be that you are carpooling with your friend. You are sharing a vehicle with your friend, or taking the bus or train or cycle. And so it's not so bad. Or waiting a little bit more time. And we are all used to our air conditioning and all of that, but let's look at the nature of it.
Yes, ma'am. Right.
Thank you for the questions.
Thank you very much for your answer, ma'am.
And I would like to just, before we end, I would like to share the 2 papers I discussed, because I'm seeing a lot of requests about. So here are the 2 links to the paper. If you want to learn more about the presentation, about the papers I made. So these are the 2 papers I presented today, and they are both available. One is in Applied Geography, and the other one is in Journal of Geovisualization and Spatial Analysis. Thank you. So any other questions?
Is there anybody wants to say something or interact with ma'am?
So it's very quiet.
Okay.
No question. Please, Priksha, proceed.
Okay, there are no questions, ma'am. So we will move to our ma'am, Shunal Shom, ma'am. It's your session now. Um, uh, Please go ahead.
Thank you, Priksha. First of all, I should say thank you very much, ma'am. So I'm very glad to see you, to meet you in this platform. Otherwise, maybe we can never meet. So it's just like a good sign that we are having this situation. And so now we are exploring this virtual world too, and we can interact with each other, we can see each other, and we can talk with each other. As you are staying in USA, we are staying in Bengal, but it has become very easy for us to interact like this. But in the offline mode it was not possible, it was quite impossible, and it was very hectic. It was then it will become hectic to reschedule your appointments and then come here for a long time. So it is our pleasure. It is our honor to have you with us. We spend really a nice time with you. Not only we have knowledges, not only we learn something, but we really spend a nice time with you. Not only the content sharing, but also knowing each other. It was really good for us. I just liked your session. It was very, very informative, very, very lucid, and I must say that everything you said, but in a very nice, very simple way, very understandable to the students and us also. And another thing, that it was very compact and presentation too, very informative and very systematic presentation. After that, you wind up your session, you wind up your PPT with the saying that the conclusions and what we learned from it. I think the students will really enjoy your session, though they are, I think they are feeling shy or something to interact with you, as they are not very much comfortable with this English language, though they can speak in Bengali too. But their background, I think they are not quite very much forward in this. Afterwards, they will become also. But really, we enjoyed your session. It was very nice. And the way you talked about the human mobility, which reduces due to pandemic, and the in a web page you shared, it was very interesting for me to show, to see that and know about that. We all do not know about that app also, and it was very interesting, a new thing, a new thing we learned from you. Really nice. And the second part is about the air pollution. The finding was very interesting to see in those maps, in those applications of GIS, which was very nice. And the maps and the diagrams you showed, and you talked about that in a very nice way, very systematic way, and very to the point it was. And we really enjoyed it, really liked it. So we are very happy to hear from you. We are happy to have you with us, and I am thankful to you. And also the thank you word is not enough for you, though we have to tell you thank you, and we have to tell you very much that you are connected with us. We will like to see you in another session, in another someday, and we should again interact with us. And I'm thank you to the entire team of the geography department, who has their effortless, who have spent a effortless time make us successful of this webinar, this special lecture session. I'm thank you to Dr. Tapan Kumar Das, especially to our convener, Sir Keshav Mondol, our anchor, Priksha Viswas, entire team, and my colleagues and co-workers of this of this college, of this department, and also to the participants. I'm really thankful to them. And above all, I thank our principal, sir. Without his patronage, we cannot arrange such kind of webinars. And so it was very nice and very successful one. We really enjoyed it, and thank you very much, ma'am. Have a good day. Have a good day ahead. Have a good night, and stay healthy and stay safe and be connected with us. That's all. And Priksha, now you can wind up the session. And if anyone wants to say something to ma'am, so they are free enough to tell her. One sir has requested to come and visit to Cooch Behar. So it's a humble request from us also. Please, ma'am, one day if everything gets fine, please come here. We will very happy. We will feel very happy to have you with us.
And we will
Definitely,
give
definitely.
you a toot to Rajbari also, ma'am.
Yeah, that's I was just looking up, believe it or not, my other web page, I was looking at Cooch Behar Rajbari. Isn't Gayatri Devi from there, or?
Yes, ma'am. Gayatri Devi is from here, originated.
Yes, yes,
Most empowered woman in that era.
yes, yes,
She was
exactly.
very learned person and
Yeah. Yes, so I would be,
have
no,
all education from London. Yeah.
I'm going to take your invitation and I'm going to visit Cooch Behar at some point, and I hope you'll take me
Obviously,
around.
ma'am. We will wait for you. Thank you,
And
ma'am.
thank you
Thank
all.
you.
Thank you for listening on all the interesting discussions. I enjoyed the discussion more, and the feedback. Feel free to
Yes,
send
ma'am.
me feedback.
Yes,
And-
ma'am. We all are. We all too. Priksha, now the session.
Okay. Thank you,
Say something.
everyone. Thank you, everyone, for being patient with us. The participants are requested to fill up the feedback form, and after filling up that, you will get your certificates of participation. But there is one more announcement that we can only provide 100 certificates per day, so please be patient with us. And thanks to all, thank you all the participants, thank you ma'am, thank you all my colleagues. And just I want to say that have a good night, and ma'am, especially ma'am, have a good day ahead. Thank you for being with us. So I'm ending this session in behalf of my department and my college. Thank you.
Thank you very much.
Thank you, ma'am. Good noon. Thank you.
Thank you
ম্যাম
very
ভালো
much.
থাকবেন ম্যাডাম, অনেকদিন বাদে।
Thank you.
Cooch Behar আসলে পরে একদম পাক্কা ঘোরা যাবে।
হ্যাঁ, আমি আপনাকে
রসগোল্লা খাওয়া যাবে। রসগোল্লা আর ইলিশ মাছ খাওয়া
কতদিন
যাবে।
পর আপনার সাথে কথা বলুন তো।
রসগোল্লা আর ইলিশ মাছ এই দুটো খাওয়াতে হবে, আর তাছাড়া
অবশ্যই ম্যাম। একদম।
Alright, bye.
Sure.
Thank you, Priksha, for a very
Okay,
good
ma'am. Bye.
Thank you.
থ্যাংক ইউ ম্যাডাম, আবার দেখা হবে।
Okay,
ওকে
bye.
ওকে।